Well, thank you very much, Kathy, for that so kind introduction. And this is one of those situations where I feel like I should be the one listening and you guys should be the ones talking because you have such wisdom in the room. I'm going to try and open some of that up. That's my job tonight, is to get you guys thinking and to get you guys talking, because my guess is you know far more than I do. But I'm going to stimulate your conversation a bit. As Kathy mentioned, I went to the University of Minnesota as an undergraduate. I just thought I'd spend a minute explaining why I care about Minnesota's economy so much. Me and my wife, our families have very deep roots in Minnesota. So my father is from Warroad, Minnesota. Anybody here from Warroad? No? Close? Roseau? I don't want to know, right? Warroad. My great-grandfather came to what is now Warroad in the 1890s to homestead. And my grandfather was a commercial fisherman on Lake of the Woods and had a mink ranch into the 1980s. My father left Warroad in 1950 to attend the University of Minnesota. So, he came down from way up here down to Minneapolis. But what's interesting is my grandfather graduated from the University of Minnesota in 1931. He had actually already made the trip from Minneapolis back home to where he was. So I'm bringing this up because one of the things I think we forget when we talk about rural, urban, is we have these connections already there. And a lot of times they're dormant or unknown, and we need to energize them. We need to activate them. We need to take advantage of them. I also want to mention that my wife is from this area. She had family come to the area that's now around Redwood Falls, Granite Falls, the Minnesota River Valley, starting in the 1870s. She's also a professor, by the way. She's really big into family history and genealogy, and she's traced all of the homesteading and everything that was done down in there. She was born in Benson. She grew up around Kirkhoven and then Hutchinson. And we met at the University of Minnesota the first day of her freshman year and the first day of my sophomore year. And we've been together for 36 years. So Minnesota is in our roots. We were gone for 8 years for graduate school, and then I was a professor at Bowdoin College for 3 years. And wouldn't you know it, those were the years when the Twins won 2 World Series. But I forgive them. That's what I'm worried about, is it's correlation, not causation. So I love this state, and I care a lot about it. And one of the things that as an economist that has frustrated me, and especially as an economic historian, is people don't tell the story of the economic history of the state. So I'm not going to tell you the whole economic history tonight, but I want to use that to inform your conversation. Now, one of the things that you hear a lot if you read the paper, if you read blogs, if you listen to the radio, wherever you get your media about Minnesota, and I'll actually go back to the title slide for a moment, is gaps. You hear that word all the time, gaps, gaps, gaps. You hear housing gaps, broadband gaps, income gaps, achievement gaps, transportation gaps. It's like all these, my gosh, we're like some kind of set of canyons on the prairie or something. We got all these gaps. Well, let me tell you, as an economist, we have a way of thinking about this that I think would be useful. When economists see gaps, when we see differences, for example, in wages between 2 occupations or between 2 geographic areas, or if we see differences in prices between 2 markets for the same thing, what we see are opportunities for mutual gains. This is an opportunity for both sides of a gap to benefit. And I think that's what we need to do in Minnesota. I would argue we need to identify what those gaps are. We know what some of them are, but I think we need to be more precise about it. And then take a look at them as opportunities for everyone to gain. Not just the people, say, who have a higher wage to help out the people who have a lower wage, or for people who have more of one thing than another to bestow something, but for both sides to gain. So, what do I mean by that? Let me start out by telling you a little bit about Minnesota's economic history. Economic growth in Minnesota since World War II is actually a really interesting story. What I'm going to do is show you a few pictures. And here's the way to look at them. And I promise, I'm an economist. I'm not going to bury you with numbers, equations, all this kind of stuff. But to keep my union card, I do have to show you graphs, right? Okay, this is the given. The way to look at the graph is look for where the number 1 is. If you're at the number 1, that means that you're at the same as the national average. If you're above 1, you're above average. If you're below 1, you're below average. So here's the first picture. Here's Minnesota since World War II. And in particular, in this slide, we go from 1947 to just at the beginning of the Great Recession. Now, here's 1. Now, you thought you could just sit back probably and let me talk for a while, but I'm not going to let you. What do you see? We're above average now, but were we always? No. And I think this is a fact that a lot of people don't either know about or appreciate. In fact, if you go back, Minnesota was above average before 1900, had fallen to about 15% below average by 1920, stayed there until World War II, and has gradually come from about 15% below the national average to about 10% above in average income since the mid-1950s. We're the only state in the country that did that. Okay, well, I'll be careful. There are 2 others. But there are 3, the 2 other states aren't very interesting, if you ask me. One is New Hampshire, and that's easy. It's Boston, suburbs of Boston. And Virginia is the other one, and that's easy. It's Washington, D.C. You can tell those stories really easily. Minnesota is a lot more interesting. Why did we become average has been my obsessive question, actually, for about the last 15 years. Now, one response to this when I first started showing these kinds of numbers was, well, it's just a Midwest story. So, fine, let's take a look at Minnesota and its neighbors. Here's Wisconsin in blue. Wisconsin has actually fallen since World War II relative to the national average. Now remember, the tide is rising, so everybody's income is rising, it's just that theirs isn't growing as fast. So relative to the national average, Wisconsin's falling behind. There's Iowa. And notice Iowa has this kind of ripple in it. The agricultural economy hits a lot harder there. South Dakota. North Dakota. If I add in the oil boom, they kind of get close to the green line. That kind of brings it close. So it's not an upper Midwest phenomenon. It's a Minnesota phenomenon. So if we're going to understand it, we can't just say, oh, it's something going on with the 5-state area. I'm old enough to remember the TV forecast was always, and now the forecast for the 5-state area. No, it's Minnesota. It's something going on here. So now let's get to the center of what we want to talk about tonight. How about metro versus non-metro areas in Minnesota? All right, so let's look at the same kind of graph. So here's the Minnesota, still in blue. And we only go back to 1969, unfortunately, for the data. There's something you could fund me for. I'll go back and get the data. I had to throw it in. Couldn't help it. So here's Minnesota. Here's metro areas. And by metro areas, I'm using the census definition. So that includes Minneapolis, St. Paul, St. Cloud, Duluth, Superior, Fargo, Moorhead, Grand Forks, and East Grand Forks, and Mankato, I believe, are the ones that are in that sample. And Rochester. See, that's what, I don't have notes in front of me. I should know this. But of course, here's the real issue. Here's this gap. And this upward trend that Minnesota as a state has experienced is primarily driven by this upward trend in metro areas. Average incomes in non-metro areas have pretty much been bouncing around the 80 to 83% range. They're not experiencing a strong upward trend. So that's gap number one. Now, let's take a look, rather than at over time, let's take a look at a point in time. So here's a picture of median household incomes in 2015. That's the latest data that we've got available, by county. Darker colors mean higher average household incomes, median household incomes. Lighter colors mean lower. And the scale is actually here. I'll be giving the slides so you'll be able to review these more carefully. But you notice, here's the highest income concentration right here, also Rochester. And then lighter colors up here, up in the Red River Valley, down this way. And then notice, here's the lightest colors. This is less than $50,000. I gave a talk up in Onamia 5 weeks ago. Wonderful conversation series that's being put on between the Mille Lacs Band and Catholic Charities to get people to talk about their economy. Minnesota's median household income in 2015 was the U.S. median income was $54,000 for a household. Minnesota's is $61,000. Mille Lacs County is $49,000. Aiken County is $42,000. Onamia is $27,000. And in fact, when you look at the distribution across the households, 20% of the households in Onamia have a household income of $10,000 or less. Okay, so there's tremendous disparities in income just within our state. Now, here's a question I always ask my students. So what? Why does this matter? Well, let's take a look at some other measures and see what matters. So for example, here's high school graduation rates, and in particular, high school students graduating on time. So the percentage of students in the population by county who are graduating on time. You might have thought that that would look maybe like the mirror image of that income map, but it doesn't, right? It isn't the case that the high graduation rates are all concentrated here around the Twin Cities. That's not true. There are dark, high graduation, that's 90% or more, all over the state. There's no strong correlation between rural, urban, between rich and high graduation rates. Oops. How about health care? Residents who are under 65, what percent of them are uninsured? The darker color indicates more people who are uninsured as a percentage of the population. Well, again, it kind of matches up with the income, but not entirely. Notice this is dark in here. It's 6 to 8% uninsured. It's not as low as around this ring here or down by Rochester. And notice there's very high numbers here. The highest is right here in Beltrami County. It's 12%, which nationwide isn't that high, but for Minnesota, down here we're talking about 2 and 3% rates of uninsured. So it's a factor of 4 or 5, even 6. So I don't know about you, but when I look at maps like this, I start to have things get put together in my head, but it's hard to see what conclusions I ought to draw. I see gaps. I see health gaps. I see education gaps. I see income gaps. But what do you do about them, and how do you actually quantify any of this? Well, let me give you a suggestion. Back in the 1970s and 1980s, 2 economists, one from Pakistan, Muhammad al-Haq, and one from India, Amartya Sen, started developing an idea called the Human Development Index. And what they argued was, what we want to do is enhance people's capabilities for living a good life. And that income alone, education alone, health alone don't capture it. You've got to get all those things together. It's a spectrum of those kinds of things. So starting in the 1980s and 1990s, they developed this measure and started applying it on a global basis. In the last few years, the Social Science Research Council in New York has started applying this to the United States at the state level. Actually, let me, before I show that. So here's what I was saying. I forgot that I had this slide. So it's a combination of standards of living, access to knowledge or education, and a long and healthy life. And I'm not going to bore you with the details because that would really show I'm an economist, so I'm not going to do that to you. But the idea is we get data on all three of those measures and construct an index. So here's what it looks like for the United States. Darker is a higher Human Development Index. It's not perfectly correlated with income by any means. There's an association, but it's not perfect by any means. Now, the highest is Connecticut. The lowest is Mississippi. Minnesota is second. So one reaction to this would be to pat ourselves on the back and say, oh, that's really good. That's great. One thing that this organization has, though, is they've actually dug down a little bit. For California and for Mississippi, they have actually drilled down to the county level. Unfortunately, they haven't done that for Minnesota. For the rest of the country, they've only done it to the congressional district level. But thanks to my daughter, who's very good at graphics, she's a senior graduating from the University of Minnesota, she helped me put this together for Minnesota, at least at the congressional district level. The high level of human development that Minnesota exhibits is driven primarily by this area right in here, with slightly lower in this area. Now, I don't know about you, but what this picture drives me to think is, my gosh, I'd sure like to know what the counties up here look like. I would really like to know that, because if I'm looking at how to use my resources as a foundation, I would like to know, well, wait a minute, what's happening in terms of human development in, say, Monoman County or Mille Lacs County, right? Or somewhere out here in Yellow Medicine. What's going on? We don't have the data. So here's my first point of the night. I've made a number of other ones, but here's my first big one. How can foundations, nonprofits close gaps and unlock mutual gains? Well, we need to know where the gaps are. And so I would argue a really good thing that we could do if we all work together would be to identify these gaps in human development at the county, city, and even possible township level. Because right now, we're just kind of thinking the gaps are out there, but we don't know where they are. We need that information. And the information's out there. It isn't a matter that we don't have the data to do it. We just need to actually sit down and do the calculations. So that's my first point, is if we're going to talk about gaps, we need to identify them more precisely and not simply say, there's an income gap, there's a broadband gap, there's a so on. Let's show where they are, and in particular, let's use the Human Development Index to figure out where they are. So that's my first big point. Second point, I have to go back to being an economist. Now, don't let theory scare you. Again, I'm not going to have equations or anything like that. I just want to tell a story. And the story is about, well, why is it that some areas have incomes that tend to be higher than others? And why is it that some areas grow faster than others? It's the original founding question of all of economics. The first book on economics by Adam Smith was an inquiry into the nature and causes of the wealth of nations. It was all about this. That was in 1776, so we've had a couple hundred years to think about it. Ultimately, it boils down to two factors. First of all, what economists call the participation rate. That is, the fraction of the population that is doing paid employment. Now, I'm not minimizing non-paid employment. I'm just talking about the growth of measured per capita income. We could have a great discussion about unpaid work and caring and all the important stuff that really goes on, but I thought I'd focus on this tonight. So, get more people into the labor force, a higher fraction, and then increase the amount that each person who is in the labor force, increase what we call their productivity, their output per person. That's it. You got to do one of those things. You either got to make each person more productive or get more people in doing that same level of productivity. Well, of course, that begs a question. How do you do that? Okay, well, let's focus in on output per worker. Labor force participation, we can talk about that, but the big factor when we look at things is output per worker over time in the United States and especially in Minnesota. Well, it turns out that, again, that boils down to two factors. The two ways that we can get more output per worker and get it to grow faster is either give each worker more resources to work with, more tools, better health, better education, more natural resources. And then my favorite one is the circle there in the middle. I have to throw some jargon in to show that I'm a professor, right? Maybe not, but growth of total factor productivity. In plain language, what we mean is taking what we've got and doing better with it. Now, I'm just going to do a pop quiz here. It'll just involve raising hands, and I won't keep track of anybody's answers. How many think that the most important factor in, say, America's growth or Minnesota's over the last 100 years is total factor productivity? Okay, how many think that it's resources per worker? How many have no idea what I'm talking about? Okay. Well, I'm asking that question because back in the 1950s, if you'd have asked a room full of economists, they would have said, well, it's obvious, it's resources. That's why it's called capitalism. It's capital. You make machines and tools and all this stuff. That's got to be what's driving it. When we started measuring it, though, in the late 50s, 90% of the story is this. And nobody's been able to change that result since it was first published in 1956 and 1957. We've been able to make it a little bit smaller, but it's always 60, 70, 80, 90% of the story is because we take what we've got and use it better. So if we put this all together, why do some countries, some regions, some states, some cities have higher levels of per capita income or grow faster than others? It's got to be one of three things: participation rates, resources per worker, or total factor productivity. Now, let's think a little bit about Minnesota's history for a moment. If you take a look at Minnesota's history for a moment, you can look at three distinct periods of time that fit this model. Basically, look at the period up to about the First World War. I bet you can figure out which one is the most important factor here, or the two that are most important. Participation rate, get lots and lots of people working as much as you can, and resources per worker, right? Get farms as big as you can possibly get them for a population and for a certain amount of capital that you've got. Get as much land as you can to fell trees. Get as much land as you possibly can in order to dig iron ore out of the ground per worker. That was the story of Minnesota's growth. It's resource intensive. But remember, I told you a little story. By the 1920s, we had fallen below the national average, partly because that was not a very good way for the economy to grow anymore. We were experiencing a lot less bang for the buck every time we added another few hundred acres to our agricultural productivity, or added a few hundred more acres in which we could fell trees. It wasn't adding as much at the margin, to use the economist term. So what happens? Well, I won't bore you with the story. If you want to hear it, I'm glad to tell you some other time. From the early 50s through the 1990s, what we did was we started focusing on total factor productivity growth. But in particular, what we did was Minnesota borrowed technology from the rest of the country and the rest of the world. We caught up, is the term that economists like to use, or catch-up growth. Not the vegetable, not the condiment, but catching up. So for example, we were just talking at dinner, George, about IBM. One of the things that Minnesota was able to do was basically copy IBM's technology at places like Control Data, tinker with it a little bit, and then sell something that was a little bit better or a little bit cheaper. You might disagree about whether it was better, so I'll say cheaper. But the same was true in medical devices. We didn't invent the defibrillator in Minnesota. A heart surgeon in Buffalo, New York did, but we were smart enough to read the medical journals and notice, oh, there's this new technology out here, and send somebody out to Buffalo and say, how about we buy your patent, and we'll start manufacturing it for you. So we adopted new technologies. I would argue that that process has played out about as far as it could go. In fact, it was playing out starting in the 80s and 90s. So that now we're in a different situation. I like to date it from roughly 2010, but you could probably go back to 2000 if you want. How are we going to get the economy to grow now? Given that participation rates have stabilized, given that quantities of human capital and physical capital are growing relatively slowly, we might be able to boost that here and there, but over the long run, we can't make that grow very much faster. And innovation has picked up. And this is, to me, a really interesting story. When control data and Honeywell and a lot of those countries disappeared in the 80s, the knowledge stayed here. Unlike Route 128 outside Boston, people stayed in Minnesota and they took their knowledge and they moved into areas like medical devices and, believe it or not, retailing. The reason you can have Best Buy is because you have really good information technology people. The reason you've got Target is you've got those people who were at Control Data, they were at Honeywell, they knew that kind of technology and they put it to work. So we've been able to take advantage of a pickup in innovation, but ultimately what's really going on is we've got to get total factor productivity growing faster. And especially, we need to take advantage of this factor in rural Minnesota, or non-metro, or greater, however phrase you want to use it. That's where we've got to focus. Now, here's my second big point. If we identify the gaps, what are the things we ought to do? You can probably give me a litany of them, but I'll give you my greatest hits. Education. Early childhood is absolutely critical. We're having a debate in this state about whether to have expanded pre-K for everybody, to have scholarships and target it. In a way, from an economist's point of view, that doesn't matter. Just do it. Okay? Just pick one or pick both, but just do it because it needs to be done and the payoff will be high. Art Ralnick probably wouldn't agree, but he's not here, so I'll let that. Art and I disagree about this a little bit. We need to work hard on graduation rates, and especially we need to work on graduation rates for students of color. I live in St. Cloud. I've had 2 children graduate from Apollo High School. When my daughter graduated in 2013, 30% of the graduating class was students of color. When my son graduated last spring, it was 45%. There are stark differences in the graduation rates between white students and students of color. We've got to close that gap. It's absolutely critical. And then one that I'm particularly passionate about, especially as every birthday ticks by, is lifelong learning. Or as one economist has put it, we need to learn how to unlearn and then relearn again. We tend to think of learning as something that we do when we're young and then we use it the rest of our life. No, we have to learn things and then unlearn them and learn new things as we go along. Investing in health. If we can identify human development index gaps, one of the ways to close them and to mutually benefit everyone is to do something about the health conditions in places that have relatively low human development index scores. For the young, prevention is obviously important. For adults, wellness. I mean, I have a mirror, I can look in it, and I say, I need to do a better job. I need help. We all need help. We need to get a culture of wellness. This third one is, again, particularly passionate for me. My parents are 84 and 81. They don't want to go to the hospital. They don't want to go to the nursing home. They don't need to. But our system needs to be set up in a way that they don't have to go into a hospital or a nursing home to deal with the things that they need to deal with. As my dad says, they usually get on a cruise ship around the 1st of January and don't get off it until the middle of March. He says it's cheaper than assisted living and the food's better. Well, why? Okay, we could do a better job. There's a gap right there. There's an opportunity we could deal with. Public capital and government. 3 things here. First of all, I think we get a little bit bogged down in the idea of having more transportation. We need to concentrate on better transportation. I mentioned to you the community conversation I was part of up in Onamia a few weeks ago. When people started talking about the things that they needed, transportation came up, but it wasn't that we need better roads or that we need better bridges or anything like that. It was a 70-year-old woman saying, I need to be able to get to the clinic on the other side of town and I can't get a ride. Or another man who's 75 years old and recently lost his wife, he said, I need to go get groceries every so often. It's easier for me to get on the bus that goes to the casino up near Brainerd because it stops at Walmart in Brainerd and I can buy my groceries there. I can't get a ride to the grocery store in downtown Onamia. There's a gap. There's something that needs to be closed. I keep saying we need a rural Uber, but you guys are a lot smarter than me. We need something like that. We need to improve the productivity of our water and sewer systems. This is something that's just a crisis in rural Minnesota. We had a fund in the 1950s that the legislature started where communities could either borrow or get grants to create storm sewer systems and wastewater systems. And I remember actually being in this room talking to Dan McElroy about 5 years ago, and he said, yeah, that's one of the things that we really let go in the 90s and in the early 2000s when we were having budget problems. We basically just let that atrophy. Well, it's coming home to roost. We've got to do something about this. Businesses can't locate in places like Albany or Avon, Minnesota if they don't have a sewer hookup that's adequate to what they need. It's not sexy, but it's really important. Finally, I couldn't talk about public capital and government without mentioning this last thing because this one's close to my heart. Many of you probably knew John Brandel. John was late in his life. I had the privilege of him being a mentor. He came back to St. John's and taught for a few years. And one of the things he emphasized was that when you're looking at things that have to do with public capital and with government services, you shouldn't think of competition or community, you should think of them both. Some things it makes sense to use the market system and to use competitive mechanisms to allocate those resources. But there are a lot of times where community, where people just working together as friends, family, neighbors, through their churches, through communal organizations of all types, that's the best way. He said that he saw that because, of course, John got a PhD in economics, so he was drilled into his head the benefits of competition, but all of his schooling until his PhD was with the Benedictines. And he saw that community is just as important as competition, and that they can complement one another. Finally, one that I know that a lot of you are interested in is broadband internet access, so I thought I would just mention this. There's a lot of interesting studies on this. And again, I'm referring back to this community meeting that I had a few weeks ago, but it really touched me and it really stimulated my interest. So I went to some data that the FCC puts together. 83% of American households have access to broadband internet. Now notice, I'm saying access. Doesn't mean they're actually hooked up, but it means they could access it. Minnesota does a little bit better. We're 87%. Mille Lacs County was 62% when I looked it up. Aiken County was 29%, and in fact, that's all in Aiken. Once you get outside the township and city limits of Aiken, there is no broadband access. Yet, at the same time, the school district is looking at having students have either laptops or iPads on which they're supposed to do their homework. And they're supposed to turn in their assignments before they get to school in the morning. That's not physically possible unless you've got some kind of broadband access. We're literally making it impossible for students to go to school if we don't have this. So, on that happy note, how can foundations and nonprofits close gaps? Well, we have to identify the gaps first. I made a pitch for human development indexes, but there are lots of different ways you could do it. Then once we identify them, what we need to do is invest resources to improve things, and my top 4 would be focusing in on things that improve education, that improve health, or those two things together are what economists call human capital. Transportation, but not just more, but really transportation as connectivity, and the same thing with broadband internet, connecting people with the wider economy. So with that, I'll simply say thank you, and then I think we have time for some questions if you like. So.